Hello, and this is wonderful Black Heritage Month or African American History Month. I wanted to talk to you about a very serious topic, and that is mental illness that sort of plagues the African American community. And for a long time, we talk about those stigmas, and I wanted to talk a little bit about that in this podcast. First, I want to salute one of the great black psychiatrists, and that's Dr. Patrice Harris. She's actually a personal friend of mine. She happens to be the first woman of color to be the president of the American Medical Association. And she also happens to be one of the world renowned black psychiatrists. So I want to give a salute and a shout out to Dr. Patrice Harris in this wonderful Heritage Month that we celebrate those persons who have made great contributions in the world. And let's talk about this mental illness or depression. I've written a book called Depression in the Pews, and it's something that's very dear to me because I have a dual role in that I am both a black psychiatrist and I'm also a elder in the church. And so I get to see kind of the duality of some of the stigma. First, I want to ask you, what do you think depression is? Do you think it's an altered mood causing tearfulness? Do you think it's anhedonia, loss of interest? Do you think it's loss of appetite? Do you think it's hell off? What do you think it actually is? What is normal blood pressure? I ask this question because, a lot of times, when we think about depression, it affects blood pressure. It affects a lot of different things about us. And so, you have to wonder, is it 140 over 90, 130 over 87, 150 over 100, or none of the above? What is sugar in the African American community? Is it something you season food? Is it diabetes mellitus? Is it a seasoning, or is it all of the above? And my last question, stress affects what part of the body? Does it affect your hair, causing alopecia? Does it affect your stomach? Does it affect the urinary systems, or does it affect neurological systems? So these are all some questions that I want to ask, and you're going to find out some of those answers as we begin to move and talk through. First, I want to just throw out one of the scriptures just to let you know that even people in the church might have a little bit of depression. David wrote in the book of Psalms that the righteous cry out and the Lord hears them. He delivers them from all of their troubles. And when I read that scripture, I began to think about that particular one scripture. And then that there are a number of even scripture references that let us know that there's even depression in the church. Here's another one. Jesus said, "Come to me, all ye who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, because I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy and my burden is light." I'm going to give you another one. Another one says, "Come unto me, all ye that labor and are heavy laden, and I will give you rest. Take my yoke upon you and learn of me, for I am meek and lowly in heart, and ye shall find rest unto your souls. For my yoke is easy and my burden is light." So I bring those scriptures out because a lot of times in the church, we were taught that you couldn't be depressed. But I'm going to tell you a secret. Did you know that 70% of pastors actually fight depression? Did you know that 71% of pastors are actually burned out? Did you know that globally, 3.7% of American adults thought of suicide last year, and some of those people were actually in church? Another point, depression is actually more common in women. But you know what else? Women make up the largest population of churchgoers. Did you also know that women are more likely to develop major depression than men? And did you know that most of us men, we don't reveal our emotions publicly? So I want to kind of talk about this intersection. But let me just review something with you. Well, first of all, what is depression? First of all, depression is a medical problem. So you hear that term a lot, and it has to be diagnosed by a medical professional or a clinician. Um, you have to have 2 weeks of depressed mood or loss of interest. So you may not think you're depressed. You may just say, I just don't feel like being bothered. And oftentimes, people that are depressed, they function. You can function with depression like you function with hypertension, like you function with diabetes. So you don't necessarily have to be at home in bed. You can be at home in bed with it, but you can be a functional person with depression. And sometimes it's those persons that are closest to us that recognize that there is a depression. So you have sleep too much or too little. You don't really want to do anything. Guilt, hopelessness, energy, slow, guilt, hopelessness, appetite disturbances, concentration problems. Sometimes you just don't want to do, you don't want to move, and then that's your suicidal thoughts. And you have to be very careful with the suicidal thoughts because that becomes an emergency and you have to go to the doctor, to the hospital for that. So I just wanted to review with you kind of the clinical signs and symptoms of depression because that becomes important. Now, let's talk about the role of the church and how this church sees this whole thing of depression in Black History Month. Now, that was a survey that was taken of a number of parishioners. And let me tell you what it showed. It said that 57% of the people surveyed would like for the church to talk more about depression. 58 wanted the church to provide more training to the members. This is greater than 50%, y'all. 61% would like the church to improve people's knowledge about mental illness in general. 63% wanted the church to break the taboo surrounding depression and discuss it openly, because many churches don't talk about it openly. Many pastors don't want to address it. And 74%, that's almost 74, that's greater than 2/3, wanted the church to assist families with finding resources for people in their families with depression. So I just wanted to share with you all that this is a major issue. And the stigma is there because when we think about in the African American community where most of the resources are, most African Americans are receiving treatment in the criminal justice system. I hate to say it. But the church is there to help because a number of people won't come to a psychiatrist or they won't go to the PCP. So there is a role or intersection of the church as it relates to depression that we see in the pews. Now, I'm not saying the church has a primary responsibility because every person should go to his primary care doctor, or if you really are feeling some bad thoughts, to a therapist or even to a psychiatrist. But it becomes important for us to bring this stigma to a close. Talk about it. Bring it out. Talk about what it means to have the concept of depression in your family. Now, one thing when you talk about depression, we talk about medication. Do we medicate? To medicate or not to medicate? Because people say medications alter your body. Well, 9 times out of 10, somebody in your family smoking cannabis, ganja, reefer, whatever you want to call it. I mean, I do drug testing in my office. Everybody drug. I just look for cannabis. When I see cannabis now, I don't get excited. But everybody's smoking hookah, gummies, brownies, or whatever. So when we talk about medicating, I don't know why people get surprised, because essentially when it comes to antidepressants, they work on the receptors, and most of the antidepressants are safe and efficacious. Antidepressants do not make you forget your problems, first of all. whatever the issues are, whether it's financial problems, problems on your job, problems in your relationship, or if it's all of them together, the antidepressant is not going to make you forget your problems. They're going to still be there. But it's important for you to consider pharmacotherapy if you're not doing any better with just therapy. They don't change your personality. Your personality is developed by the age 15. If you have whatever your personality is, that's what it's going to be. So the medications will not change your personality. Yes, they can have some side effects, one being decreased libido. So if you're taking medications, you can have decreased libido, could have decreased appetite. Sometimes your stomach can get a little upset. You can have side effects. But remember, antidepressants are not addictive. Some other medications we use for other disorders are addictive, but they are not addictive. And yeah, antidepressants can cause some weight gain. But for the most part, the medications are safe and they're efficacious. So when you want to consider whether to medicate or not, hey, you want to talk with your physician, and your physician can help lead you and guide you to a wonderful, wonderful treatment plan. A lot of times when we in the church, we want to look for causes of the problem. Now, I tell you now, there are a number of causes of depression. The first one, when you look at in the church, is spiritual warfare. When there are conflicts going on internally, spiritual warfare can be one. A lot of loss, financial stress, divorce, and medical problems. All of these issues can cause depression. But it's very important to go and see someone so you can find out why you are depressed. I do believe that everybody should have a spiritual part. So when I treat people for depression, I look at the biopsychosocial spiritual model. So that becomes very important for me that you have a spiritual aspect. Now, if you don't have that aspect, then I won't, it kind of leaves us in a kind of a different spot. But it becomes important for you to have that spiritual aspect. So we have something to sort of help you with some growth and some development. We've talked a little bit about depression. We've talked a little bit about looking at some of the differences in treatment paradigms. I talked about medications. Now there's therapy. Now, what kind of therapy do you need? That could be cognitive therapy. Now, what cognitive therapy is when you really go in and you look at the negative thoughts. And cognitive behavior therapy, what you would do with your therapist is sometime there's something called automatic negative thoughts that we have. And what we do with that is we help you to capture those negative thoughts and retrain your thoughts. Now, you can have something called supportive psychotherapy. Now, what we do in supportive psychotherapy is that you just have a lot of stuff going on. And we need to help support you through your crisis, support you through your problems, support you through whatever's going on at that time. And then there's something called trauma recovery therapy. Now, trauma recovery therapy, that is when there has been a trauma. Traumas happen sometimes early, middle, and late in our lives. Now, depending upon what the trauma is, that's how we have to manage that whole process. And I want you to know that traumas don't just vanish. So we want to help you with the trauma. I have to tell you about the dreaded suicide in our community. Suicide is now in the Black community. There was a time when it was not there. We were able to manage our stress, manage our stressors, and do what we could do via other mechanisms. But now there's been an exponential increase. Some of the risk factors are, of course, mental illness, bipolar being a high predictor, male, owning a gun, military service, substance abuse. These are some risk factors for suicide completion. And I want to just share with you in this podcast, if a person verbalizes to you that they have thoughts of self-harm, or thoughts of ending it all. Believe them. I just want to share this podcast with you in this time. I have a book out. It's called Depression in the Pews. It goes in detail about the phenomena of depression. It kind of differentiates the difference between sadness and depression, where it comes from, how to look at it, and it can give you a lot of help. And you could use it for trainings. You could even call me for some training. And any way it can be helpful. Now, what you can do is you can scan the QR code to purchase it. It is on Amazon. If you get it, you want me to sign it, you can come by my office. I'll sign it for you. Once you can get your 4 or 5 copies of it. If you want to get me for a workshop, I am available for workshops. You can just simply email the office. You will be able to talk to the executive producer. There'll be a way you can get in contact, but we will be available. We do want to get the word out. There is a stigma. There are issues, and we really want to help extinguish some of these and get out there and get the word out. There is no panacea for depression, anxiety, schizophrenia, but we want to make you aware. And remember, pound 988 is that number, or that suicide hotline number. And always 911 is always going to be there. And if you have any questions, be sure that you call your primary care doctor, call your local psychiatrist, and everybody has a local mental health department. But if you get stuck, dial pound 988 and have a wonderful, wonderful day. And I hope this has been helpful. Thank you for stopping by. A healthy mind is essential for a healthy body.